Messieurs les présidents de l'Académie de médecine, de la Fondation de l'Académie de médecine,
chairpersons of the Medical Academy and the Foundation of the Medical Academy, Your Excellencies, Dr. Yves Juillet, thank you very much for this invitation. Dear colleagues, ladies and gentlemen, today I propose to think about the concept of global health. We will take a historical perspective to see whether this new concept is still relevant today and whether it can help us to understand health issues in our contemporary world and future health issues, for example, those emerging in Africa. The expression global health appeared for the first time in an Institute of Medicine report published in 1997 in the USA. The title was America's Vital Interest in Global Health. In Chapter 2, the notion of global health was defined.
The world's nations, the US included, now have too much in common to consider health as merely a national issue. Instead, a new concept of global health is required to deal with health problems that transcend national boundaries, that may be influenced by circumstances and experiences in other countries, and that are best addressed by cooperative actions and solutions.
When Bill Clinton occupied the White House in 1996, the year before the report I just mentioned, he issued a presidential decree announcing that the U.S. would focus its public health action on infectious diseases, on fighting the reasons for their spread. And the rampant urbanization and population growth were seen as issues as important as national security. Studies coordinated by South Africa show that prevalence rate of HIV infection amongst soldiers of many African states are much higher than in the overall population. How could these soldiers be called upon to maintain peace across Africa?
Insiste le rapport. HIV is by far the most important of the new infections, both globally and in the United States. L'élaboration de la notion de global health est...
And the emergence of this concept of global health, as we've seen, is closely associated to the AIDS pandemic in sub-Saharan Africa at the end of the 90s. And as a result of these analyses, the security metaphor underlying development aid to these countries emerged. The geopolitical relationships by South Africa and the United States really explain the development of the concept of global health. This was mentioned by the President of the United States as well as Kofi Annan, who was then Secretary General of the United Nations. The same decision or concept was endorsed by the United Nations Security Council in a resolution issued in 2001. They decided on the founding of a global HIV health fund.
Special appeal to donor countries, the business community, including pharmaceutical companies, the private sector, philanthropists, and wealthy individuals. En pratique, c'est un fonds pour lutter contre 3 maladies.
The fund was established to fight 3 diseases: AIDS, malaria, and tuberculosis. It was more than a simple HIV fund. Public and private funds focused on AIDS, and there's therefore inequality between patients in the same hospital. In Africa, women suffering from obstetric complications or patients suffering from typhoid fever, diabetes, heart problems, or other pathologies die, while in the department next door, the AIDS patient can survive thanks to drugs bought by global partners. There's even greater inequality damaging the health status of children. Isn't that one of the greatest challenges of our contemporary world? Concerning the big health issues and challenges of our contemporary world, what are the other challenges? We could simply talk about the risk of emergence, re-emergence of an infectious agent rising with population increase in bad living conditions, and so on. But today, chronic diseases are bigger killers than infectious diseases. Diabetes. History professor Harari ironizes, saying that sugar is now more dangerous than gunpowder. Have we really also understood the impact of mental illness, road accident, the effects of pollution, and climate change? Antimicrobial resistance reached a peak in 2016. Resistance to antiretrovirals is spreading. Fake and illegal drugs are creating great losses in developed and developing countries. And this is jeopardizing the achievement of some of the Sustainable Development Goals. So let's focus on cross-cutting challenges. These need to be considered. Otherwise, we cannot have an impact on the global health paradigm. First, there is growing political disinterest in health issues, lack of democracy in global health governance, and thirdly, lack of consideration for health workers. Let's take the first issue with politicians more and more uninterested in health issues. Amartya Sen described health as one of the major factors of development. However, politicians don't seem to be interested in the health status of their populations. Most African states spend less than 10% on health, sometimes less than 5%. Jihadist groups take hold in areas where there's no public service reach. For example, in the Sahel-Saharan area. This is a threat to stability, and fear can wreak havoc. There's also an imbalance in World Health governance. This is a threat. American development agencies such as USAID or private foundations such as Melinda and Bill Gates Foundation, they have mobilized billions of dollars. But the U.S. government has stopped contributing to major donor efforts. They've been taken over by private organizations. The Bill and Melinda Gates Foundation is on a board with strategic decision-making in Geneva. Aren't these procedures anti-democratic? Because normally it is member states convened in a General Assembly at the UN that should be setting global health priorities. The same thing goes for WHO. And the political and democratic structures of African countries is also jeopardized. States and governments are no longer the main decision makers. Will the political dimension be completely swept away in the years to come? Then lack of consideration for health workers. In a report called Healthcare in Danger, the International Committee of the Red Cross describes human health violations that health workers are exposed to in situations of conflict. During the first quarter of 2018, over 100 attacks were perpetrated against Red Cross and other health workers. There have been deliberate assassinations in Syria. Health workers have to flee the regions where they're working, sometimes never to come back. There is total disrespect for the 1951 Geneva Convention, for example, that protects health workers. The global health paradigm seems not to address this contemporary challenge. Then there are future issues and challenges. How can we project scenarios in an uncertain world? Many actors are thinking about the future. The Harare book published in 2015, then the National Intelligence Council report in 2017 entitled Global Trends Paradox of Progress, and in France, the book by Stephen Smith, La Ruée vers l'Europe, Young Africa Preparing to Take Over the Continent, and the book by Bruno Latour, loosely translated, Where Should We Land? What are the Political Orientations? Or another book on the revolutions of the 21st century, revolutions that have an impact on very important decisions that we make individually and collectively. And later, the National Academy of Sciences, Engineering and Medicine recent report, Global Health and the Future Role of the United States, which followed another important report by the Institute of Medicine. Many reports inform the U.S. government on what may be a threat to global populations. A couple of things we should consider when strategically thinking about our future. First of all, issues related to how we produce knowledge, and secondly, migratory flows. First of all, producing knowledge. The beginning of the 21st century saw a fight between science and communication. Communication took over in order to save face and to continue attracting funds. International organizations tend to overplay health results in poor countries. Access rates to drugs or health facilities are not expressed as a proportion of the target population, but they are expressed in the absolute number of users of health services. At best, there is 0.35 consultation per patient per year. That means not even every person gets one health consultation every year. So there's an ethical, epistemological challenge and threat to science itself. Also, this produces an unreal scenario based on which official decisions are made. It's unreal when Western countries represented in United Nations agencies and others make decisions for recipient countries. Then I mentioned migratory flows. Since the Second World War, 5 million people or more have had to flee their homes, their countries, owing to famine, climate change, war, persecution. 86 million people are also expected to have to leave their countries in Africa by 2050, only owing to climate change. Then there will also be displacements owing to population increase and wars. Then there was the migration crisis in Europe, where 1.4 million people fled to France, over 1 million in France. Most of them come from countries on the borders of Europe that are rife with conflict, Afghanistan, Syria, Iraq. There is still a lot to find out about the impact of migration on migrants and over the overall population. There's prevalence of viral hepatitis, for example. In the host countries in Europe, we sometimes see migrants being refused care, not being able to access healthcare facilities like citizens, like regular citizens. Multiple addictions, tobacco, alcohol, cannabis, cocaine, crack, and other substances. Multiple addictions are already a major health issue in the US and in Europe for young people, for people living in the streets, and migrants who are sometimes extremely young. In a context of massive migration, as we will be facing, can we prepare our politicians in our countries too. Huge upcoming public health issues. So, can this concept of global health help us to address the challenges and issues of the world to come? The answer is no. The concept as it has emerged cannot be redefined, cannot help us to address these coming health issues. First of all, because the concept of global health is historically ontologically associated with only one disease, HIV/AIDS, which at the time was considered by the US as the supreme health emergency, and therefore global health was boiled down to one risk, that of an epidemic. Then also because the concept was developed unilaterally based on the fears of a number of political leaders and not supported by medical or scientific evidence. Therefore, global health is not a science. Thirdly, because by its very nature, the concept of global health and the institutionalization mechanisms that are associated with it cannot lead to a systemic, holistic strategy, an equitable strategy that takes into account young people, young girls, teenagers, who within a few years will make up the bulk of the population in Africa. In Niger, 50% of the population is under the age of 15. In Burkina Faso, half of the population is under 17 years of age. In RDC, the median age is 14. Fourth reason, because of the fact that many leaders make the overarching decisions in terms of public health, there is no equal representation in health decision-making. The WHO has to work with a money-making pharmaceutical industry. This makes the organization more vulnerable, less independent, less technically endowed, although since 1948 it is supposed to be independent, and this protects its democratic legitimacy. Last reason, in the area of health, the health of populations cannot be seen as global. Public health systems cannot be global, even in a globalized world. Trying to achieve universal health coverage around the world, these attempts illustrate this. Maybe we made a mistake in thinking that globalization would go hand in hand with some kind of standardization, but there are still differences. They're part of nature, and the health sector is that where there are the most glaring inequalities, where climate, geographical situation affect biodiversity, entomology, as well as infectious risk, health, sex, life, and life itself. And any attempt to be blind to these differences undermines equity, and only climate warming indicates to us that there is a global population, that we are but one. In a book on La métaphysique alpha de la sagesse de la jeunesse, Aristotle wrote, whoever has the definition without experience and has knowledge of the universal but ignores the content of the universal will be making a mistake, will take the plural for the singular. Global health is an oxymoron. Reverse innovation would have it that people wanting universal cooperation would embrace innovation coming from the southern hemisphere. We will have to resolve this dialectic between global and local, singular and universal. Brazil, Indonesia, Thailand, South Africa, or Senegal are founding members of the Diplomacy and Health Group launched in New York in 2006. For these countries, health can be an instrument of diplomatic influence. Could we not start an international health diplomacy movement? We need to innovate in health, but also in diplomacy, etc. And that is at the basis of my approach. As a doctor, I wanted to start teaching at the Political Science Institute, Sciences Po. In one book, an author proposes a basic principle on which we must rethink globalization, inequalities, migrations, climate change, ecology. What are the new concepts based on which thinkers of the Southern Hemisphere think the world? What would be the place for artificial intelligence as part of future strategies? Walter Benjamin said that a catastrophe is when everything stays the same as before. And by choosing the theme for this forum, the scientific team avoided the disaster, because nothing will be the same afterwards. Everything, there's still time to reinvent everything. Thank you.